Alright, so today let's start off by learning a self-massage technique for your mid-back muscles that are located between your shoulder blades. These are what's known as the rhomboid muscles. The rhomboid muscles, they attach to the thoracic bones of the spine, and then they basically go out and attach on the shoulder blades. And one of the things they do is help pull those shoulder blades back, like when you're doing a row at the gym. They work opposite the pectoralis major. So, if the rhomboids become weak, that can result in forward shoulder posture and create an imbalance. So, one of the things is some of you will have to strengthen rather than stretch the muscle, but giving a little bit of a massage, self-myofascial release, it's a great thing just to help the muscle function a little bit better. It's great for if you sit at an office, at a computer all day, or driving, if you want to make sure that you can have those muscles properly mobile so you can strengthen them and make the posture better. So one of the things you have to do for the rhomboid massage is you can have to make sure you have the right tools. One of the things you're going to need is a pair of therapy balls that are either attached or therapy balls that come together in a sleeve that you can pull tight and it's safe. I say that you could put 2 tennis balls in a sock. That's a little more risky, and I don't want you hurting yourself, because one of the things is you got to be safe on this channel. That's a baseline right there. So make sure if you don't have the tools, you go to the link in the description and you order the right tools so you can do this. Now, one of the things is you have to make sure that you have the 2 balls so it has a gap in the middle, because you do not want to put pressure on the bones of your spinal column. That could hurt yourself, and the worst type of injury that you can have from putting too much pressure on the spine is you could paralyze yourself. And on the lesser parts, you can just have some kind of nerve damage. So please make sure you have the right tools if you're going to do this particular technique.
Now to start, let's take our towel and place it down about where we're going to put our upper back on. The towel is really meant to prevent any slipping from your body off the therapy ball. You don't want to do that. You can hurt your back. Now what you're going to do is put the ball right in the center of that, and with either your own guidance or the help of a partner, you'll slowly position yourself so the ball is between the shoulder blades and it avoids touching the spine. You can just put a little bit of pressure to see if you're on it, and if you are and not on the bone, then you can sink into it. You can do this, you can hold and you can breathe. You can think about opening up your chest to really contract those muscles on to the area that you're compressing. And if you want a more active, like a stretch and contract movement, just to kind of break up the tissue, get your shoulder blades away from you by reaching out in front of you and bringing it back. The arms just like that. Ooh, I can feel it myself. Breathe as you do this, active breaths. This is more of a warm-up activity. Then when you're done, put your arms and your hands to the side. Slowly come up off of it, and then you'll have done a little bit of self-massage to your rhomboid muscles.